Healthcare Access Now, also known as HCAN's mission is to build partnerships that result in a better connected primary care system for the uninsured and other vulnerable patient populations who do not have consistent and affordable access to preventative, primary care, and other ancillary or social services.
We're unique in that we're working at the grassroots level with individuals, with mothers who may have problems connecting with prenatal care, with adults who come through the hospital emergency departments looking for a prescription refill. And we're connecting more with a high-touch versus a high-tech solution to address populations, to address people living in all of our communities who sometimes get blamed for being the failure of the healthcare system when actually our systems are not designed to take care of them.
The 9-county Greater Cincinnati region has a $14 billion healthcare system that serves more than 2 million people. Part of this population, about 20% or 400,000 people, lacks access to health care and is in a health crisis. As a result, individuals are not getting the care that they need, and it's straining our system. Treating these people costs 5 to 10 times more than it costs to treat the general population. Experts estimate that if care coordination were provided to these people, then $500 million could be saved each year.
The social determinants of health, I think, are what we can collectively say is our work. Things that many of us take for granted in terms of just getting in our car and riding to the doctor, or having money for a prescription refill, or having a doctor to even call. Those challenges are every day now, as people are concerned about if I take time off from my job, will I, to go to a doctor's appointment, will I even be able to keep my job? These are very real things that people are facing, and they're called the social determinants of health. And so what the literature is finding, and what physicians are even saying, that if they had a prescription to write for every time a patient presented to them the social, environmental challenges of getting access to health care, they would be writing 7 or 8 prescriptions a day. And so for this reason, we find that our uniqueness is, and the impact that we're having is engaging these patients and connecting these individuals with community health workers who support the patient, who coach the patient, coach the adult, coach the mom about addressing those barriers to care so that we can have better health outcomes.
HCAN functions as a care coordination hub to manage pathway programs that offer intensive patient navigation and support to achieve better health outcomes. HCAN employs community health workers, also referred to as CHWs, for each of its pathway programs to work with individuals who face health and social challenges. CHWs are trusted community members who connect healthcare providers with the community. They possess indigenous qualities that ensure that they can culturally and linguistically connect with community residents. CHWs have an understanding of the community's health beliefs, behaviors, and barriers to health services. Often they are individuals who have experienced some of the same challenges as their clients. In short, CHWs are non-clinical staff that fill the gap between the individual and the healthcare system.
HCAN brings community health workers that really care. A lot of times it's not about just doing a job. My favorite part of being a community health worker is the fact that I give back. We all have a story to tell in our lives, whether it be good, whether it be bad, but I can relate to some of the things that some of the women that I help have gone through.
As a community care coordination hub, our current projects include an emergency department care coordination pathway, a pregnancy pathway, a chronic disease pathway, and prescription assistance. Since 2008, HCAN has served approximately 4,000 adults who are at risk for poor health outcomes and do not have a regular source of care. Our emergency department care coordination pathway and pregnancy pathways have both been particularly successful. An average avoidable hospital emergency department visit cost at least $4,000. Our program cost $125.
This program has reduced the number of emergency department patient visits by 60%.
The average cost of one poor birth outcome is about $65,000. Our pregnancy pathway program costs $1,500.
90% of the mothers enrolled in this program delivered a baby with a normal birth weight.
Healthcare Access Now is not just another social services program. We are a small nonprofit working on a grassroots level to improve healthcare processes, with not only the goal of helping the individual access better quality of care, but also saving the community money.